with nutrition, you can really improve your insulin resistance without even pick up a pill or any supplements. Because honestly, remember when I mentioned before, my A1C had went into the pre-diabetes range. And with the knowledge and the information that I've been sharing with my patients, I apply that to my own personal health. And within just 6 weeks, my A1C went from 5.7 to 5.4.
Welcome to Thriving with Diabetes, the podcast where we empower people with type 2 diabetes to live their best lives. I am your host, Gamden, a holistic wellness coach, helping people overcome challenges related to type 2 diabetes. I have dedicated my passion for health and wellness to helping people like you navigate the complexities of diabetes. I believe that with the correct knowledge, mindset, and support, you can manage your health condition effectively and lead a fulfilling life. In this episode of Thriving with Diabetes podcast, we are diving deep into the crucial intersection of diabetes and fertility. We will explore the remarkable journey and expertise of Dr. Tien Promlap, a pharmacist and a diabetes fertility coach, who is dedicated to helping others achieve their dream of a natural pregnancy. We will talk about insulin resistance, hormonal balance, and nutrition. I'm so excited to have our guest with me today, Dr. Tien Promlap. As you know, that our podcast is all about empowering people with type 2 diabetes to lead healthier and more fulfilling lives. And having experts like Dr. Tien on the show helps us achieve that goal. It is always inspiring to learn about our guests' perspectives and experiences. Before we dive into our discussion today, I would love from Tien to introduce herself, share some background about her and what she does. So without further ado, I will hand it over to Dr. Tien Promlap to introduce herself. Dr. Tien, welcome to Thriving with Diabetes podcast.
Hi, thank you so much for having me on your podcast today. I'm super excited to be here to talk to your audience a little bit more about diabetes, infertility, and the natural conception, in case some of the patients who are listening could be having issue conceiving. Diabetes is not something that most people think about that could prevent people from having a natural pregnancy. But in my field, so I actually help women with PCOS conceive naturally. So that's my mission in life, and that's basically my background. So my background, I'm a pharmacist. I've been practicing pharmacy for over 7 years. And when I was trying to conceive on my own journey, I was having difficulties. And my A1C actually went to the pre-diabetes range. And in finding that out and relating that to my irregular cycle and hormone imbalances, PCOS was basically the the cause, I guess, of the subfertility. I don't like to call it infertility because it seems like such a harsh word and saying like you can't conceive. But with diabetes, hormone imbalances, insulin resistance, and PCOS, along with other metabolic syndrome, you can still have a very healthy and natural pregnancy. We just have to know exactly the nutrition component of it and how you can change your lifestyle in order to increase your pregnancy chance. So that's really my mission in career wise, and also a little bit background about me. Thank you so much for having me again.
Brilliant. Thank you for sharing your mission and health journey as well in terms of profession, being a profession or a professional or an expert. So you know that metabolic syndromes can be complex and challenging. Could you explain what metabolic syndromes such as insulin resistance and how they related to diabetes and fertility?
So, metabolic syndrome is basically a pretty big umbrella. It just means your body is not able to metabolize certain things properly. So, like insulin resistant, your body isn't utilizing insulin, which is a hormone that normally helps bring your sugar from the bloodstream into your cells and organs for energy. So, your body isn't able to do that. So, any kind of dysregulation in your body function, we call that metabolic syndrome, right? And you can also have metabolic syndrome with diabetes, overweight, underweight as well, and PCOS in the term of hormone imbalances. So there's our other hormones, estrogen, progesterone within PCOS that aren't leveled out properly in the body. So that's why we call this metabolic syndrome. And in the case of diabetes specifically, a lot of the time we do focus on insulin resistance because for patient with type 2 diabetes, insulin resistance doesn't really go away. It kind of just either you get a control of the condition or it does go on and become other complications like kidney disease. You can have heart problem. You can have strokes. We don't want to scare you, but I'm just like telling you the prospect of type 2 diabetes. When I was still working at retail pharmacy, a lot of the time, I don't like, because patient on social media or Facebook groups nowadays, there'll be claims that you can kind of reverse the condition and permanently eliminate type 2 diabetes or insulin resistance. But that's not the case. Once your bodies already have some sort of metabolic syndrome or insulin resistance, you can either get a really good grip of it and have a good control of the condition and manage it really well and still live a thriving and fulfilling life, or you don't do anything and it does becomes more of complication later in life, and we don't really want you to have to go through that. That's basically my take on metabolic syndrome.
Brilliant. Thank you for sharing that information. What are the key factors or symptoms of metabolic syndromes that people should be aware of? So how do we know that a person is suffering from any kind of metabolic syndromes?
Yeah, really good question. So it can be very subtle, these symptoms. A lot of my patients would tell me cravings is one of their symptoms that they notice a lot. And stubborn weight gains or weight loss is another thing that they will tell me about. So those are the two main things that my patient will want to really focus on. And if you are in the more fertility side of things, you can have irregular cycles. So your periods don't come every 28 days like a person without metabolic syndrome would have. or you can also have irregular ovulation. So say you still have a period, but you actually don't ovulate normally. So the hormones in the reproductive system aren't where they're supposed to be. So that's another sign of metabolic syndrome. So if you're not in the fertility side, most people would have trouble with like sweet craving, or sometimes really gut health in general, like bloating a lot of the time, or other physical signs can be acne a lot of the time, as well as facial hair feature like hirsutism and PCOS. That's another sign of metabolic syndrome. They don't all have to occur at the same time. You can have one or two or all of the above, and you could still be considered metabolic syndrome. And of course, weight is one of the important things that a lot of doctors and wellness professionals will look at for metabolic syndromes.
Brilliant. Thank you for sharing some information about the symptoms. I know you focus on helping women. So, you know that irregular cycles and hormonal imbalances can be a major obstacles for women. So the question is, how do these issues interchange or affect diabetes, and what strategies do you recommend for balancing hormones and regulating cycles?
So in terms of diabetes, hormone imbalances, I would probably only really consider insulin resistant as the hormones that you should really worry about when you have type 2 diabetes. And how do you actually improve insulin resistance? I believe there are many medication, right? In my field of pharmacy, there's metformin and other medication you could start on, but my actual recommendation is major nutrition up leveling, honestly, because with nutrition, you can really improve your insulin resistance without even pick up a pill or any supplements. Because honestly, remember when I mentioned before, my A1C had went into the pre-diabetes range. And with the knowledge and the information that I've been sharing with my patients, I apply that to my own personal health. And within just 6 weeks, my A1C went from 5.7 to 5.4. And in that time frame, my cycle actually also regulated, and my ovulation started to regulate. And that was so much easier to conceive. So I know I don't look, overweight, and I don't seem to have, I'm not out of shape. Like you can't really tell that I would have pre-diabetes, honestly, when you look at me physically, right? But a lot of the time when people don't see that, the doctor can't really, they don't want to, kind of categorize you into this diabetes or like the metabolic syndrome. You don't look like you're supposed to have those conditions. So what do? They don't really know what to do with you. Honestly, they're kind of stuck. So that's when nutrition really comes into play, and major lifestyle changes is really another thing that I recommend. And those two things are really big component of how to really improve your insulin resistance for diabetes in general.
Brilliant. Thank you for sharing that great insights. You have just mentioned a very important point, which is nutrition. When we talk about diabetes, often nutrition is the first thing to focus on or to worry about, which plays a crucial role in managing insulin resistance. So the next question is, what dietary changes should people with type 2 diabetes and fertility issues consider to improve their chances naturally?
Yes, of course. So we know a lot of the time the low carbohydrates diet would be recommended. Even for me, when I went to the doctor and we got a labs result back, and without even any kind of personalization, I got this email message from my doctor. She said, everything looks good, but it looks like you have prediabetes. Let's start you on a low carb diet and start exercising more. That was literally all she sent me. And I was just like perplexed, like, oh my gosh, like I was just 30 years old and you told me I have prediabetes and this is all you sent me? So a lot of my patients feels the same way when they come to find out their diagnosis, and a lot of time it's already type 2 diabetes. Like A1C would be in the 6, the 7s, and they'll just start, oh, here's metformin. There you go. Have a good day. Nobody really mentioned anything about how to really help these patients, right? So what I really want to focus on is taking a look at your current diet and see where we can kind of improve upon. I don't want you to think about it where I have to stop eating a certain food and only eat a certain food. So like the all or nothing mindset really hurt people, and that will only make you crave what you already love more. So say you really love french fries and the doctor tell you can't have french fries anymore. What will you do? You will start eating more french fries and or crave it more, and then you will binge it, and then nobody wins in this situation. So you can still have the french fries or the donuts or the pizza. I don't want anybody to think that they can't have comfort food and still live a full, fulfilling life with type 2 diabetes and bring down your A1C, your blood sugar, or improve your insulin resistance. What I want you to think about is add on to your diet the food that actually will help. So something that I made a switch in my current life. So I grew up eating white rice, and it's not the most nutritious carbohydrates, right? It doesn't have any nutrients that you actually want. So what I've switched to is quinoa, which is an ancient grain that has so much nutrients for fertility, PCOS, and it's improved your insulin resistance as well because it's a whole grain instead of a refined processed grain. So I want you to add more whole grains to your diet. So that's one recommendation, right? And another thing will really help is dietary fibers. So quinoa also has an incredible amount of dietary fibers as well as protein. But other things with fibers are a lot of your green vegetables, fruits, legumes as well. So add those to your diet. Another thing that I really love that has a lot of fiber is chia seeds and flax seeds. So those things help you, what's the word? Not spike your blood sugar so fast. It actually gives you a more steady blood sugar increase, as well as help control that craving, because dietary fiber is really difficult for your body to digest. And that way, your body actually takes longer to digest, lower the blood sugar, and improving your craving at the same time. So that helps improve insulin resistance. So those are the two dietary things that I really recommend. Those are two major things for your audience with diabetes. But we can't really skip about exercising as well, because that's another thing that really help improving insulin resistance. So maybe we'll chat about that in a little bit. But dietary wise, that's my recommendation.
Brilliant, brilliant. Thank you for sharing these great insights, and you already shared very interesting information about nutrition, and you are saying it's not just the nutrition alone, and we need to be physically active.
Yes.
Brilliant. The next point we want to discuss is natural pregnancy. You know that achieving a natural pregnancy can be a dream for many. How does your guide and expertise help women with metabolic syndromes increase their likelihood of achieving a child naturally?
Yes, so many of my patients will come to me with wanting to kind of cut down on medication because they already tried. They already tried medication. They already tried supplement, but it's not working like they're supposed to. So along with nutrition, so that's kind of like my 50% nutrition is the formula for achieving natural pregnancy with metabolic syndrome. And then I would add on also physical activities. We talked about that, so I'll go a little bit more to that. And then the rest of the formula to actually achieving a natural pregnancy is your mental health. You have to take care of your mental health as well as getting really, really good quality sleep. So nobody really talk about quality sleep for achieving natural pregnancy because most of you are either really busy or achieving quality sleep is really difficult for them. That's when we really talk about it, but the benefits is so amazing. It helps you regulate your hormones while you sleep and making sure that you are rest and reset for the morning as well. And when you have good quality sleep and you kind of decrease on screen time around bedtime, it also helps regulate your hormones that way because the screen time is actually what's kind of messing up your hormones that aren't already in balance like we're wanting them to be. But let's kind of back up and talk about the second component, which is physical activities. Why I recommend physical activities so much also is when you are working out, and this is not just you walking around at work or like walking to the mailbox. Why those things are also good. They're a good start. But I want you to actually think about exercising as well. Because when you exercise, you actually are improving your insulin resistance, so balancing that hormones, and that really helps with improving your ovulation as well. So insulin is not needed while you exercise to move sugar from the bloodstream into your muscle for energy. The muscle would just take up the sugar naturally already. So without using insulin, you are improving insulin resistance if that's something you worry about. And when you have lower insulin level, your progesterone is lower, and it doesn't mess with your ovulation. So that's really helped with fertility. So that's why I recommend exercising. That's just like a small summarize simplification of it, right? And then the next thing was we wanted to get really good quality sleep, right? We talked about that. And then mental health. So I recommend doing yoga, meditation, seek therapy if you need to, right? I'm not a therapist, so I don't pretend to be one. I will actually recommend and kind of source that out if my patient need it. But I do recommend yoga, especially fertility yoga. So one of the things that I found out recently that is really, really helpful for women with like unexplained fertility or really low AMH, which is just another hormones that can mess with fertility. But that's basically the whole component of how to achieve natural pregnancy. So it's a lot. So that's why you kind of need like guidance and, a little more information than just our chat here on the podcast. But if you can improve all of those aspects of your life, natural pregnancy will come.
Brilliant. Very interesting information. Thank you for sharing that. I was going to ask you about lifestyle changes for diabetes, and you have already shared some of them, like nutrition, physical activity, stress, and sleep as well. So what is applied to natural pregnancy or fertility can be applied to diabetes. So if you want to talk about more, if you want to talk more about lifestyle changes and healthy habits for diabetes.
Yeah, we can do that. So I know we kind of touch on the lifestyle changes a little bit and having really good sleep quality and helping you improving your mental health. But let's actually talk a bit about how you actually can implement these ideas. So for my patient and for me as well, because we live in a really busy world and everybody has a really busy life, either with work, with kids, with school, you name it, everybody's busy, right? Nobody has time to fit in, honestly. So squeezing in 30 minutes of physical activities can be really challenging for a lot of people. And I know I mentioned, just having walking to the mailbox to get your mail or walking your dog around the block. While those are really great, and I do encourage you to get as much movement in as possible daily, what I want to recommend is actually adding a little bit more of actual exercise. So creating habits and routine is going to be your key to success. And I know waking up earlier or going to bed earlier sounds not really fun, right? But once you get into a habit and a routine of doing these things, it's going to really help. So what do I mean by waking up earlier? So I have a 16 months old. She's a toddler, so she's a lot. And I work full time as well. I don't really have time for exercising. So how do I do it? The only way I found that it's good for me and efficient for me is waking up before my toddler to work out and then start my day. But if you find that working out, after work is better, do that, right? Kind of figure out where in your routine that feels natural to you. Doesn't feel forced. It doesn't feel like, ugh, I don't want to do this right now. Like, if you feel that coming on, you're not going to do it. So I don't want you to have to force yourself into doing something that is not natural to you. So if you feel like working out later or during the day is helpful, you can do that. But I will say that working out earlier in the day will kind of jumpstart your metabolism. Even I work out before I eat breakfast. There is scientific reason behind this, only because if you really worry about losing weight, a lot of patients with diabetes and PCOS will tell me they like to lose weight. I don't really care about losing weight for myself. It's just convenient for me to work out in the morning. But for those who really want to lose weight, when you work out before you actually have a meal or kind of breakfast, your body's going to start burning off some of those fat storage that you have, because it's a mechanism when your body needs energy and the sugar amount is limited, so it's going to start using fat storage, which means it's going to help you lose weight. So that's just a little plus if you do decide to work out earlier during the day. But if you can work out any time of the day, that's what you do. I don't want you to feel forced, because otherwise you're not going to do it. And once you find that rhythm, that routine, and that's kind of effortless way of life, keep showing up. The first step of all healthy habits is to actually get started. It's so hard to actually show up and work out, show up and do your walk, show up and do your exercise. But once you do, you're going to feel so good after, and remember that feeling. I want you to, once you've done it, remember that good feeling that you have after exercising, how good it feels to take care of your body, how good it feels to sweat, how good it feels to actually move your body. And remind yourself of that feeling every single time that you don't want to get started, and that will help further start your routine. And consistently showing up is how you're going to actually improve your health and improve your lifestyle. And not only that, it helps with mental health too. Working out has been proven to actually reduce stress and improve quality of life for all aspects, not just diabetes or fertility, but in general, right? So just think about that. And another thing I'll mention is meditation and journaling. If you can get into the habit of doing that every day, maybe before bed, 5 minutes of sleep meditation, jot something down into your journal. I recommend this to my patient every single day. Write down something that you feel like you accomplished during the day. 3 good things that you accomplished during the day. How proud you are of those things. And that will help you kind of keep going every single day.
Brilliant. Thank you for sharing these great insights and tips. So what you are saying is I will take it as a pro tip. Try to make a change as a habit, so it becomes something we do it easily, so we don't have to think too much about it when it becomes a habit or part of our daily routine. Is that correct?
Yes, exactly. So having routine and habits is kind of like waking up and brushing your teeth. You don't really think about it, you just do it anyways, right? So that's how you're gonna really change your lifestyle.
Brilliant. Thank you for confirming that. Let's talk about some common misconceptions when it comes to type 2 diabetes and fertility. Are there some common misconceptions or myth that you often hear from your clients or patients regarding type 2 diabetes and fertility?
To answer that, yes, and there are a giant list of misconceptions that I hear all the time and myth, diabetes and fertility in general. So let's talk about just a few, like the major ones. So for diabetes, I really always hear my patient tell me, I can't have fruits. And I don't really understand how this came about, but it is such a big misconception and myth. I have fruits every single day of those 6 weeks, and my A1C went down majorly. So, you guys, please eat all the fruits. Those are the source of nutrients that you're going to need, and also fibers that you're going to need. We talked about how fiber is so important for improving insulin resistance and reducing cravings. Because one of my patients told me, I stopped eating bananas. Because when I eat bananas and I check my blood sugar, it goes up so high. So I'm going to kind of talk about this a little bit, right? Yes, if you eat a banana and you check your blood sugar immediately, of course it's going to go up. Any kind of food that you eat, whether it's a salad or a steak or a banana or bread, if you check your blood sugar immediately, of course it's going to go up because all of those food has carbohydrates, and those things are actually sugar, right? It's going to get processed into sugar, and that's going to increase your blood sugar immediately. Now, why does this not matter for type 2 diabetes? If you want to check your blood sugar and really use that number to kind of indicate where you are in your journey, you're supposed to check it 2 hours after. Why? Because 2 hours is when your body actually had time to process it. So we don't care if a food increase your blood sugar immediately. That doesn't really matter. Because why? Insulin resistance is what we worry about for type 2 diabetes. So the 2 hours mark is what your body had already utilized the insulin to bring in your sugar from the bloodstream to your muscle and cell for energy, right? And if you check it immediately, your body had no time to do anything yet. So that doesn't really mean anything. You can check that for a person without diabetes, it will go up. A person with diabetes, it will go up. So the 2 hours mark is what you should be checking to see if your blood sugar has gone to under 130, 120. Those are the good number that you want to look at, right? So eat your fruit. They don't cause diabetes. They actually help you improve your lifestyle and daily habit. Switching fruit for things like more processed items like ice cream, frozen sweets, donuts actually are something you should think about. I tell my patient this all the time. It's not always easy to do because the donut looks a lot better than, the strawberries, right? But if you can do those switch, those are actually what I recommend. So that's one of the misconceptions, right? Another misconception is you have to eat a low carb diet to improve diabetes. And when people say low carb, they really mean keto, which means they don't eat any carbohydrates whatsoever. They have really, really high protein intake. And when you actually think about eating like steaks, pork, chicken, especially sticks. You think you're getting protein, but you're actually getting fat because like when you look at the component of a piece of red meat, the protein is not that high, but the fat component is much higher. So you're actually getting fat, not protein. Think about that, right? Mind blowing. But anyway, so eating whole grain instead of refined carbohydrates is actually going to help improve your insulin resistance and fertility as well. So that's another misconception. So yes, I wouldn't recommend eating white rice or white bread because those are more simple carbohydrate. They have higher GL, which are glycemic load and glycemic index. Those are just numbers that we use to measure how fast your blood sugar will increase when you eat a certain kind of food. So whole grains, things like quinoas and buckwheat, barley, and whole oats, those are going to help you have a steady increase of blood sugar so that you don't spike your insulin at all and have a more steady increase, which means it's going to help with your improve insulin resistance and really help with your A1C overall when you do your 3-month check at your doctor. And then let's jump to fertility for a little bit. With PCOS, a lot of my patients will tell me that they need to lose weight in order to achieve a natural pregnancy. And while that can help if your BMI is overweight or obese, it's not something that I really worry about because if you're eating the right food and you're eating healthier, your weight will come down naturally if you need to lose weight. But otherwise, focusing on improving insulin resistance and balancing your hormones with the nutrition that I recommend, as well as improving your egg quality, because a lot of women don't have really good egg quality due to their diet being poorly and poor nutrition. That's when things don't go the way that you want and having that natural pregnancy. So weight loss, although it can help, I don't really focus on that as my main treatment, but it can help when you need to lose weight. So that's another misconception. Because, if you look at me, you don't think I need to lose weight in order to have a baby, but I was trying for 2 years and nothing was happening. And I'm not overweight. That's why it's a misconception, really. It can happen to anybody, any kind of weight, whether you're big or small, it can happen to you. And the nutrition is what you really need to focus on, and all those tips that we talked about already.
Brilliant. Thank you for sharing these great insights and information regarding misconceptions and myths regarding type 2 diabetes and fertility. Now let's move to the next point, which is about treatment options. You can talk about treatment options for people who face fertility challenges and diabetes, but if you could share some natural treatment options and strategy so you promote for managing high blood sugar or insulin resistance, and how to, I know everything is not just to try things naturally. Maybe there is something we need to do in order to have a natural, for women to have natural pregnancy. So if you can share some treatment options or strategies.
So when we talk about treatment option, I immediately think about medication and supplements, and those aren't really what natural conception really, those aren't what I recommend normally for patients. I don't not recommend them. They're kind of like last option line for fertility in general, but I don't really have a recommendation for diabetes naturally, if that's what you're talking about, because that's really not my wheelhouse. Honestly, I do more nutrition recommendation, all of the other tips that we already talked about, like establishing routine, sleep, lifestyle changes. So those are my treatment per se, but those aren't really treatment. Those are just like changes in your life, right? But there are supplements that people can take. There's a medication, but medication aren't really natural, so I don't know if that's what you really want me to go over. But supplements could be, or like herbs. Sometimes there's herbs that are recommended for patient with fertility, and I'm not actually certified to recommend any kind of herbs, but I do have a podcast episode that I spoke with another herbalist who are more of an expert in herbs than me, and we talked about all the herbs that she was recommending for fertility, and I can kind of give you a link to that if your audience was interested. But otherwise, medication can be things that help you kind of ovulate. So there's letrozole, or what's the other one? Clomid for a patient who are looking for improving their ovulation. I don't recommend that as a first line thing that you should start. You should really try to do things naturally first before you jump on medication. But most people will start medication first, and then they come to me and they're like, Dr. Promlap, I took three cycles of this medication and I'm still not ovulating. What's going on? And so we will kind of go over and undo all of the things the medication did to her, right? And then for supplements, people do take melatonin to help kind of regulate their sleep a little bit, which really helps with the insulin resistance later on. There's another supplement that in the world of PCOS people talk about all the time, which is inositol. That's kind of supposed to help regulate their cycle and ovulation as well. There aren't really much data supporting it. I mean, there are data supporting it, but it's not concrete studies that are basically telling everybody that this will work. Because if you talk to women who have taken the supplements, half of them will tell you, yes, it worked. Half of them will say, did nothing to me. So that's why I don't usually recommend supplement. Plus, I also think that it's really hard to out supplement a poorly diet. That's why I start there first. Once you have your body as an optimal level and like the perfect home for your baby, this is talking about fertility now, then we can think about supplementing. Because there's also supplements for a lot of women who are over 40 who are trying to conceive that would help with improving their egg quality. But also I want to look at their nutrition first before I even go over this. So there's things like NAC that people would recommend. Otherwise, for diabetes, I don't really know much. I think there are cinnamons that have been mentioned. I'm not really sure. So can't really answer this question properly. I'm sorry.
That's fine. Thank you for sharing what you know already, and what you are recommending is to try to follow a natural approach. Focus on nutrition, herbs. You mentioned some seeds, supplements, natural supplements. But what you're saying is medications should be the last thing to try.
Yes, and when you have a really good quality nutrition already, and then you start the medication, it will work that much better than if you don't have that strong foundation of a quality nutrition on board. Yeah.
Thank you. I have got another question before we finish this episode. What inspiring message or advice would you like to leave with our viewers and listeners, specifically those struggling with type 2 diabetes?
So, as I do relate so much when you're finding out that you have type 2 diabetes, as when I received my own personal lab test and saying I had pre-diabetes. I didn't put the PCOS dots together at the time, so I really truly thought I had pre-diabetes and going to have type 2 diabetes, as my dad has type 2 diabetes now. He has been living with pre-diabetes for over 10 years, and his A1C is now pushed over to that level of type 2 diabetes. And my uncle has it, my grandfather has it. So it's in the family. So I understand how you feel. And I can kind of like see my own future. And I'm over here trying to prevent it, right? But as much as you're trying to do the right thing, and I know you're trying so hard every single day, because that's why you're listening to this podcast. That's why you're looking for resources that would help you live a better life with type 2 diabetes, right? So if you are already on this journey, know that your body actually knows how to do this already. You just kind of have to listen to your body. Like, what does my body need? And start there. And also be really kind to yourself. Maybe one day you do really well and you don't have any sugar craving and you didn't reach for that treat. Or another day that you feel really down and you had to have your treat and you feel super guilty afterwards, right? This is kind of like the cycle that you're on. And I want you to also give yourself grace and kindness and be patient, right? This change didn't happen to me immediately. It actually took me already 2 years in the journey to make that 6-week change. So I was in this journey for a whole 2 years before I decided to take control and change my nutrition for that quick 6 weeks change. And your result won't be the same as mine, won't be the same as your neighbor. So I would not comparing yourself either. I wouldn't compare your journey to anyone else's. You know what's best for you. You really do. Your body will want you to listen. So that's why I recommend meditation. It's a way for you to kind of reflect and think about how you can really help your body thrive, right? Think about all the good things that we recommended in this episode and how you can incorporate them. And even if you can and you fall off the wagon, think about when you actually did achieve these results and did accomplish, exercising or changing your nutrition, swapping out better food. Those are the reminders that will really help you propel forward. So don't forget, like on the bad days, don't forget that you've already done all the good things that you have been doing all this time in your journey, because people will just gravitate towards the bad stuff and they forget about all the good stuff. It happens to my patient all the time. I have to constantly remind her, you've done all these things. You can't forget about all the good things that you've done. So remind yourself of all the good things to keep propelling you forward on this journey. You're basically in this journey for the rest of your life, and that's okay. It's okay. Everybody's on a journey. It's okay that you're on this type 2 diabetes journey. As long as you're taking care of yourself, as long as every single day you wake up and you do the best that you can, that's all you can really do. That's all anybody can ask you to do. And if people aren't really understanding whether you're coming from and you feel misunderstood, judgment from other, comparison, those are the things that I want you to kind of gravitate away from. That's why yoga and meditation helps so much, to kind of center yourself and bring yourself back to your body. Don't listen to any of, the diet trends out there. Focus on the good nutrition that we talked about. And if you are working with Gandam, right, focusing on his advice instead of focusing on what social media or your neighbors or other blogs posts that you could see, because they don't know your body, right? They don't understand your journey. They might have a perspective on what happened to them and their patient, but they don't really know you. So make sure that you don't fall for that, and just really focusing on you, and make sure that you take care of yourself every day. And you're doing great.
Brilliant. Thank you for sharing your great inspiring message. How can people find you if they want to get in touch with you or learn more about you and what you do?
So I have social media mostly on Instagram or on Facebook. I actually have both. So on Instagram, my handle is Dr. Promlap Wellness Corner. I'll probably send that to Ganem and he can post a link in the description possibly. And if you want to find me on my website, it's drpromlapwellnesscorner.com or Tien Promlap on Facebook. I mean, I'm everywhere. You can pretty much find me on the web. But those are my main source of contacts.
Brilliant. Thank you for sharing your contact information. I'm going to add them in the show notes of this episode. Have you got anything else you want to say before we wrap up this episode?
Yes, I did want to mention that I know we talked about a lot of information today and you can feel a little bit overwhelmed, right? So kind of just breathe, one, and then go back and listen to the tips and the recommendation and take what you feel like would be useful for you. Well, let's start there first. Don't get overwhelmed. There are many things you can do. Just take the first step towards a good habit that you feel would benefit you today, and that would help you so much for the rest of your journey.
Brilliant. Thank you. First and foremost, I would like to express my sincere gratitude for our amazing guest, Dr. Tien Promlap, for generously sharing her expertise, insights, and time with us today. Your contribution has truly elevated this episode, and I deeply appreciate the information you have provided. I want also to thank every one of you, our dedicated viewers and listeners, for being a part of this episode. If you are seeking additional guidance and support on your health journey, I encourage you to book a discovery call with me at wellnessimpact.org. During this call, we can discuss your needs and explore how I can provide a personalized assistance while addressing any questions you may have. If you found today's episode insightful and valuable, I invite you to join our community of people committed to thriving with diabetes or to stay up to date for upcoming episodes, empowering discussions, and practical tips. Make sure to subscribe to our YouTube channel. For those who prefer other platforms such as Spotify, you can follow the Thriving with Diabetes podcast. Once again, thank you, Dr. Tien, for being our guest today. Thank you, everyone, for being a part of this impactful journey. Until next time, take care of your health and keep thriving.